Thank you guys. Amazing suggestions. I caught a few that were coming through in the chat, not all of them, but I love how everyone is thinking. I do want to talk a little about the agenda for today. So we're going to talk a little about healthcare transition, other things that are just as important, like housing, community, psychological and behavioral well-being, and then ending on some family support and recharging for this next chapter or the second act. I will ask that we hold questions while we're speaking until the end, just because we want to make sure we get through this content. We've got some lofty goals that we've set for you guys, but I think we've got some good stuff. All right, next.
Oh, great.
All right, guys. So I wanted to talk a little bit about why we're even talking about transition. Transition is a pretty tumultuous time of life if we're thinking of this 12 to 26 year time. There's some data that shows us how particularly risky it can be, right? So we've got a large percentage of the population that falls in this age range. And this is a stage of pretty rapid change, growing independence in a variety of ways. Individuals in this age range can typically regard healthcare as pretty low priority, but also engage in more health risk behaviors. And we also see more mental and behavioral health concerns in this time of life, along with lower utilization of healthcare. Next. All right. And what we also know is that most individuals, so 83%, who have special healthcare needs, and that does include individuals with autism or intellectual disability, do not get transition support, especially, and I'm talking about a medical setting specifically. And that's especially worrisome because many of these individuals do require some decision-making support. And we also know that structured transition planning really does improve health outcomes. So why, is it not always happening? What are some things we can think about? I think there's some barriers, right? So in general, are the young adults, the families are pretty comfortable with their pediatrician. Sometimes it's somebody you might even have been seeing the majority of your child's life. Same for the pediatrician. We tend to get attached to our patients. And then we worry about, oh gosh, what's going to happen when they start seeing an adult provider? And then I think there's some other barriers as well. Next, one in particular that I want to talk about is this thought that, are these adult providers wanting to take care of our individuals, right? There's this concern, like, are they even wanting to assume care? And thankfully, the data does show us that while only about 36% of adult providers feel like they're receiving adequate training in caring for adults with autism and intellectual disability, only 16% do not prefer to treat those individuals. So they do want to provide the care, the vast majority do. So we want to think of some ways that we can help set everyone up for success, the patients, their families and support people, and also the adult doctors who might be taking them over, right? And there are some initiatives in the adult education world going on because this is a pretty hot button topic. But what are some things we can think about doing? Next. All right. So I have little transition Tim here. He's starting at about 12 to 14 age. This is a goal age. Not everybody starts talking about that at this time, but we would love to have people thinking about it as early as possible so that it doesn't become just like a one-time, time to transition, which we know is not how transition works, but more of an ongoing conversation while we're kind of sequentially meeting goals. So some of the things that I like to think about in this kind of earlier transition age is, how do we identify the individual's strengths, challenges, interests? What are their preferences? What are their goals? That looks different for everybody. I saw somebody bring up in the chat, well, what if my individual is nonverbal, right? So the goals you may set for what long-term care looks like for them can look maybe a little different than someone who is more verbal. We also want to improve comfort in medical settings. So think about the fact you're in a pediatric environment. We often have a lot more supports and accommodations compared to adult medicine. It's a really good time to work on skills that might be challenging for your child. So things like blood draws, getting a blood pressure, working on that now can really help. Another thing I like to tell people to start doing is keeping a medical summary document. It's depending on where you may end up with an adult provider. You may not have a perfect, they may not be able to see the records, for example, if they're in a different medical system. And so as much information as you can keep in one place really can make it easier moving forward. And there are resources that are available to you guys that include a medical summary document example and also a health passport that can include information like what's the best way to communicate with my child, that type of thing. We also want to ask about, that's okay, you can move ahead to the next slide, ask about transition plan and goals from your doctors and really empower you as families to ask questions to your providers, both the pediatric providers and the adult providers. And so with this question slide gives you some examples of questions that you may consider asking. You know, do you have training in dealing with individuals with autism? Does your staff? If not, go ahead and give Echo Autism a plug and say, hey, this is a great format for learning. What policies do you have for transition, if any? And is there going to be any back and forth conversation or parallel care where the pediatric provider and adult provider can share information with each other and ask questions? Next. All right, transition Tim has made it to 15 to 16. A couple of other things I like to think about in this age group. What amount of support does the individual need? So for an example, if the goal is to be independent in medical visits, maybe start practicing some things like scheduling a doctor's appointment, refilling a prescription. I like to have them lead the visit with the support person in the room. Again, that's something that you can do if the goal is an independent visit, versus you may have a goal of, hey, I want my kids to be able to better tolerate medical procedures or get better at taking medications, because we know as an adult, there's not as many liquid formulations available, for example. We also want to really consider sexual development and the need for education and preparation regarding birth control options, sexually transmitted infections, important medical exams like pelvic exams, pap smears, and when those things are indicated. Is that something that we're going to need a significant amount of time to prepare for? And will we need to bring some other therapists along to help with that? And along with that comes talking about things like sexual activity and consent if you haven't already. All right, next. And so now our little transition Tim has made it all the way to being a 17, almost 18-year-old. We've got a lot of things covered, but there's still some more to talk about. Specifically, I like to make sure that our patients and families know what privacy rights change when you turn 18 years old. Absolutely everybody gets the right to make their own decisions at 18, regardless of their functional level, unless there's a guardianship obtained. And that can mean that parents and guardians can't access medical records unless the young adult agrees and consents to that. And that kind of lets us think about that question of, you know, the need for guardianship or power of attorney, possibly. We also want to think about other changes that may occur at around age 18. So are there going to be health insurance changes, changes with Social Security income that we want to think about? Are there new medical concerns, right? We're becoming an adult. Is blood pressure becoming a problem, right? Those kind of things we don't often think about as pediatric health problems that we might want to look at a little more closely as our young adults get older. And we also want to make sure that we have a plan in place for transition to all of the specialists. So an example of that would be if you have your primary care doctor, your developmental behavioral pediatrician, and a neurologist, for example. I wouldn't recommend planning to transition everybody at the same time. That can be pretty overwhelming. So maybe finding your medical home, your primary care, and then deciding who do you need to see in neurology or other fields. Something that we don't always, talk about a whole lot is that there's not always a doctor who specializes in developmental and behavioral medicine as an adult, but there's lots of colleagues in kind of complex care, psychiatry, med peds providers who will often provide that care, and that's maybe regionally dependent. All right, next. So our 18-year-old adults, Tim, hopefully is starting to get scheduled for those first adult medical providers. I like to offer, and I think parents, you should be empowered to ask, does it make sense to have that first visit with an adult provider and then maybe come back and see me one time so we can talk about how did that go? How did it feel? Is there something else we could do to maybe better prepare you? Did something feel like it was lacking or missing? Is there information I can maybe share with the adult provider that I didn't that would make it more helpful? So I think that's something to think about. And then if we haven't already obtained guardianship or power of attorney and we think that's appropriate, how do we start that process in our state? So next, this is my last slide, just a little bit of information about guardianship and power of attorney. This is certainly something you could attend a 3-hour lecture on, but just so you get a little bit of the nuts and bolts in case you aren't aware of the difference. But guardians have rights and assume the rights and the authority to make any of the day-to-day decisions. And you see a list included of what all that may encompass. And to establish guardianship, the person does lose the autonomy to make those decisions and must be considered incompetent in the court. And that is the term that they use. There's an alternative to guardianship called power of attorney, where the individual doesn't lose any rights, still has decision-making capacity, but instead it grants somebody the authority to act for him or her. There's medical power of attorneys, financial, there's a lot of different avenues you could consider, and the individual is still considered competent. So I think that where I would point you, if this is something you're thinking about, is in the resource documents, you'll see the National Resource for Supported Decision Making. And if you're in the United States, you can click on a state that you live in, and it can point you in the right direction and next step. All right, next.
All right, thank you, Lindsay. So to kind of continue on with what Lindsay's talking about from a healthcare perspective, I think as you transition to adult providers, you may want to look at this as starting a new long-term relationship, which really does provide the opportunity for you to build provider knowledge about your child, your family, and how you can make a successful partnership moving forward. One of the things we often talk about is co-producing care. So this means that like all the voices are, that are on a team are valued and they're heard. In the process, we also talk about a commitment to shared decision-making. Again, the patient, the family, the providers, and other key team members create an environment where each member brings their expertise and their knowledge to the health and treatment plans. Everybody should be contributing their expertise. I think that's one of the things I like about my son's healthcare team is that everybody's voice has a value and they bring the expertise of their discipline to the table. And I bring mine as a family member and he brings his as the patient, and it's all very important. I think the other thing that's really important in co-production of these healthcare plans, especially as you move out of pediatrics and into adult care, is really looking at the data that you can provide. You'll hear, if you ever hear me speak in any other ways, I always talk about the importance of data and how important it is. Collecting data that you see day to day, week to week, month to month, about treatment impact or maybe on medication changes or new medications that you're adding in. And bringing those to clinic appointments really help that help to produce that co-production of care environment and bring again your voice to the table so that there's a lot of conversation about, is this the right pathway that we're on? Next slide. I think, when you go to invest, in the TART, because, you're moving out of, I always say when you move out of pediatrics, it's where it's warm and fuzzy, you're moving into adult care system, and it's very different. So I think as you sort of investigate that co-production of care, there's a few ways that you can look at it. I think pre-visit planning is a great way to do it. Before you actually start to really get into a lot of appointments with your new provider, or even if you're still searching and interviewing a new provider, you can look at a few things. You can look at, talking about what's the preferred communication style of the patient. So with my son, it's a lot of visual and a lot of modeling that we will do with him as far as communicating with him during healthcare appointments. Also look at behavioral concerns that might impact care. He might be really loud during, different parts of the care plan, like or the clinic appointment. If you're looking in his ears, you're going to hear a lot of noise, most likely. And then I think also look at the support needs that are needed during clinic visits. One of the things I always say is, maybe do shorter clinic appointments so you can build tolerance for longer clinic appointments, and also maybe just do even like a happy visit where you come in, you see everybody, and then you leave. Because again, you slowly want to move into this new care environment and make it positive. It's really important to focus on the positive part of that. I think other things you can do for pre-visit assessments are, looking at, what healthcare steps do you have mastered? Can you do height and weight? Can you do blood pressure? If those are done, those are great. You know that those are going to be okay. Do you need support? Then that's something you want to make sure that the clinic knows that you need. I need a little bit more support in these areas. I think also talking through things to avoid. We had a patient in the clinic where I worked who, if you said the word shot, that was it. She was out the door. So we learned that when she came in for any kind of shots, we never said shots because it would stop her before we even could get back and then attempt, to get into those moments of where we would try to do, like her flu shot or whatever. I think also looking at where supports are still needed, and how do you build capacity for, like in my son's case, so that he can accomplish it. Blood draws are still really challenging and things that we're still looking to master for him. But I think one of the things that you should think about in co-production is that it's not how fast you get to, these steps in care. It's that you slowly are making steps in getting there and doing it in a really positive manner. And on the right side of the screen, you'll see there's just like a sample of different exam procedures where you can sort of assess, I've mastered this, I might need a little bit of help, or I still need a lot of support in this area because I'm learning it. So think about the healthcare steps that an individual is moving into when they go into adult care and where they have a lot of success. Next slide. I think the other thing I always like to say is like, what do you bring to the table as far as, learning opportunities for your new provider? Or if you want to go to the next slide, that would be great. One of the things that I try to do is like help them understand about providing care for individuals with autism. There's a list of different. We're going to have a lot of these resources in the session for you today. But one of them is like, are there different videos that you can watch? And there's some that are listed here that are actually of an individual with autism who's getting doing a blood draw, doing a blood pressure and those kinds of things. And it talks about these procedures from a patient perspective, but also from a provider perspective, so that we can help to educate from both sides while watching the same video. And then there's other things through gut transition that can really help you as you're walking and navigating the transition into adult healthcare. Next slide. I think overall, there are a few things to ask providers when you're, in this process of, establishing this new long-term relationship is, ask them to schedule more time for patients with autism, and allow time for self-advocacy skills to develop so that, there's more time to answer questions and allow the patient more time to process. Sometimes we just need to like take a pause, allow them to process so they can answer during clinic appointments. I think discuss visions for the future and identify goals and strengths and challenges. What is already mastered in healthcare and what are areas where they want to, build some ability and how can we do that? I think also prioritizing next steps for families and provide families with, ideas and resources. And then ask them to, help make connections to support. And above all, work with a provider who values the family voice and value the family role in the patient, clinic process, and is open to co-production and discussion of care. And I think anywhere you can, I think promote self-advocacy in healthcare, and do it in a strong way. One of the things I do that's really simple is that, my son doesn't have a lot of language, but when we go to his healthcare appointments, I make sure that he hands over his ID, his insurance card, and he's, at the forefront, and I stand behind him when we do the check-in process because it's part of the natural process, and I want him to be a part of it as much as possible. And it's an education moment for the person who's on the other side of that wall as well. And I think also, it's really important to work with a provider that also celebrates successes you have as a family. All right, next slide. So we're going to end healthcare right now because again, we have a really ambitious schedule, and we're going to talk a little bit about housing and community. So if you have questions, chat them in or hang on to them and we'll get to them toward the end. But I think when we talk about housing and community, there's a couple things to consider. One of them is what kind of housing do you want to go into? There's single family homes, there's planned communities, there's townhomes, what kind of a neighborhood would you like to, live in? And again, I'm speaking, from the individual's voice. So, is it more rural? Is it more urban? Do they want to live on a farm? Those kinds of things. And then I think, as we look at, even with my own son, we also need to look at what kind of supports is he going to need to be as independent as possible in housing and community access. And, it can be, does he need a few hours of support a day, maybe over a week, or does he need 24-hour? I'm a more cautious mom, so I'm going to up that because I want to make sure he's safe and those kinds of things. But again, it's those kinds of things to think about. All right, next slide. And then there's a lot of different housing options and models, and it's something that as we've been exploring housing in our own field, we've kind of learned about this. There's, models for residential support where, it's more of a supported living or a supervised living environment. And it's for somebody who needs a little more, a little more attention and a little more support. You can also go to something that's more of what they call a brick and mortar, like where we live, and it's where you own or rent. And it's, you really might be able to bring in somebody to do some support, or it's somebody who really can be a little bit more independent. And then the other thing I would suggest is really looking at creative models that might be happening in your own neighborhoods and in your own areas and cities. There's a lot of unique things that are happening where they're actually taking models where they're taking, maybe single families and, older adults who want to live in a community, but they don't necessarily gravitate towards each other. And I know that I've seen a few models throughout the United States where it really draws on how do you build a sense of community within one housing block from a lot of different types of, individuals who might live there. Again, single mom, older generation, individuals with disabilities that maybe have like a format for socialization. And so I would, again, look at some creativity and don't be afraid to like step outside the box in that area. Next slide. I think to partner with housing when you're thinking about those next steps I really think community integration is a really big part of it. And if you were at the last session, I talked about this a little bit, but I think becoming more active in your community is really important. I know that in my early years in autism with my son, I lived in the autism world and I went to all the autism meetings and things like that. And as I got older, I let go of some of that, and I started to look at what kind of community things could we do and what's really out there. I think it really expanded our knowledge of like what kind of neighborhoods are out there, maybe what kind of living options we would explore for him. But also, I think one of the things that's been really unique is that we were able to take our perspective and take it into this new community. And in our case, it was the arts community. And not only learn about the arts community, but help them learn a little bit more about the autism community, and it was a nice partnering and a nice sharing. So I would really encourage you to think about where do you have a lot of good community integration going and how can you sort of increase that? Next slide. And I have just on this next slide, just a few ways to do this. You look for events and things like that, and volunteer and for festivals, and we've done that. I think always shop and dine locally because then you get to know those small businesses and you'll see the same people, and I think that's always really nice. I think one of the ones that I shared this last time is that organize an event. We had a mom here in town that her event is that she actually will go and pick up orders at this one restaurant that a lot of people like to go to. She'll do 8 of them, and her son goes along with her. He's limited verbal skills, needs a lot of support, but that's part of his socialization. That's part of his thing, right? So it's a job. It's getting out in the community. It's interacting with people, and it's also his favorite restaurant. So it's a win across the board. So I think get creative and think about how you can do those. And again, I always say, if you have a new puppy, if you have a dog, walk the dog, meet your neighbors, take a class, those kinds of things. All right, next slide. I think Lindsay, Lisa, I'm handing it over to you now.
Sounds good. Thanks so much, Amy. So, all right, now that we've talked about a lot of important elements like healthcare transition, housing, and community transitions, I'm going to talk with you a little bit about how we can support psychological and behavioral well-being throughout the transition years. And for those of you who might be looking at transition coming up and have younger children, we're going to talk a little bit about preparing for things like puberty, assessing your child's readiness for adulthood, how to prepare things like schedules, building leisure skills, and also how to support overall good mental health through adolescence and early adulthood where things might be quite vulnerable. Next slide. All right, so first, there's lots of ways that we can assess an individual's readiness for adulthood. One important tool would be to complete a formal transition assessment. Sometimes this is a single assessment, and other times it's a combination of assessments or evaluations with different providers and care team members. The Council for Exceptional Children defines a transition assessment as really an ongoing process of data collection that focuses on the individual's needs, preferences, and interests, which is really critical. And this type of assessment can help us to gather data, as Amy said, is so important to guide and define specific goals and services that should be included on an IEP. So prior to age 22, we want to start to do these transition assessments before our children exit the public school system. And they may need to be updated periodically with new information. So for example, you may do a part of a transition assessment at 14, where we're looking at home living and self-care skills. And then by 16, 17, 18, we're evaluating skills for safe community access and participation in activities outside the home. Next slide. Today, I also want to share a few concrete tools for you that can be a helpful component of the transition assessment process. VCU, Virginia Commonwealth University, in collaboration with Autism Speaks, has developed a wonderful community-based skills assessment that helps us to identify where an individual's skills are currently and where they may need to do some skill building or development to ensure that they're ready for community living. This tool can be used with children as young as 12 years old, and it evaluates skills across 8 different functional areas of life that you can see here listed on the screen. We will, of course, include the link to this in our resources that we send out to you today or following today's presentation. And on the next slide, we'll talk about some other tools as well. You can move to the next slide. Thank you. There are also a number of different inventories that can be used to assess and begin to identify areas to build functional living skills. I've listed a couple of things specifically from the Assessment of Functional Living Skills, or the AFLS here, which includes areas of assessment including mobility, community knowledge, shopping skills, money skills, and daily living skills, all really critical, again, for that transition into adulthood and participation in community living, particularly post-school years. Next slide. Next, we're going to talk about everybody's favorite topic, managing puberty and supporting healthy relationships. Lindsay started to touch on some of these things as she went through her transition for medical timeline, but we're really going to dive in here. So the first thing, why is this important? Well, unfortunately, youth with autism are at higher risk of physical and sexual abuse, neglect, and exploitation. So we as parents and caregivers and providers really want to be very intentional about building safeguards against these potential problems. Social impairments in autism can also increase the possibility of engaging in inappropriate or problematic behaviors. Whether intentional or unintentional, this can lead to increased social vulnerability and even more serious problems. We had an important question in the chat earlier about what to do when there may be potential interaction with the legal system. And so I want us to think about 2 kinds of problematic behaviors that tend to arise in puberty. And this can include atypical behaviors that are not sexualized, but may be interpreted as touch. So this could be something like a sensory interest in touching other people's hair or skin, or the clothing of others. Obviously, we can see that those may be things that your child has exhibited, behaviors you've seen throughout the course of the lifespan, but as your child gets older and enters puberty and is entering adulthood, the perception of those behaviors by others could create significant challenges or legal problems. In addition, we also think about socially inappropriate sexual behaviors that may be misinterpreted as intentional or deviant. So these could be things like inappropriate or intrusive advances, inappropriate touch or sensory behaviors that are not intended to be problematic, but certainly could be problematic if the recipient is not consenting. So the bottom line is it's never too early to start teaching boundaries, consent, and safety. As we move into the adult years, we do want to think really carefully about competency, and this may inform your decisions about whether or not you pursue legal guardianship or less restrictive options like shared decision making. We'll go ahead and move on to the next slide. Okay, and you can click forward one more where I think I have a graphic that'll fly in for us. All right, so on the next few slides here, we're going to walk you through how we can start to prepare for puberty, even well before you think you need to. So for those with younger kids, I want you to think about starting now. If you have older children and teens, rest assured it's not too late. Think about these next few slides as sort of checklists to help you identify what lagging skills may need more urgent attention. At the end of the day, we want to try to be proactive in teaching these skills, to start as early as we can, which may be today, to make sure that we're utilizing people like our IEP team or behavioral service providers, and that we're really insistent. One of the biggest things I see is that I want you to be advocates to include your children in all health and sexual education curriculums, with appropriate modification and support. For some individuals with less language skills or cognitive impairments, they may need to be modified substantially, yet the content is still important. And we'll move on to the next slide to dive into each of these age ranges just quickly. All right, so even in really early childhood, you can start by teaching your child about body parts and anatomy, including the differences between males and females. Teach the correct names for body parts, and start to teach consent by always asking permission before touching and not forcing physical contact with others, like hugs or kisses. You can employ grandparents and aunts and uncles to help teach this and model this behavior in safe ways at home. Provide clear instructions and modeling for public versus private behaviors. For example, closing the door when you're using the bathroom. Next slide. We've got a couple examples here of how you can use visual supports or social stories to teach things like personal space. And as we move into the school age years on the next slide, we'll think about things that we can do, including making sure that our children know that no one can touch their body without permission, that only doctors or parents should ever touch private parts. If they know what's appropriate and what's not appropriate, they'll be more likely to tell you about inappropriate contacts. Teach the function of body parts and start to be very explicit about building independence with toileting and self-care. So often as individuals need some assistance with things like self-care or toileting, we create unintentionally habits that increase vulnerability for our young adults and adults as they transition into adulthood. Even things like learning how to close a bathroom door or lock a bathroom stall. For many years, we may be teaching kids not to do that if they need support with wiping or toileting, but we want to find the right time to start to teach these safety skills as well. Also, think about teaching some assertiveness training and how to say no, teaching children how to ask before touching other people, and continuing to redirect public versus private behaviors. Next slide. Moving through the preteen years, you can see that things get even more specific. For example, we're going to want to provide direct education in puberty, reproduction, and physical body changes. We'll teach about hormones and how those relate to emotions. We want to build consistency and independence to the extent possible with hygiene, including things like managing menses and cleaning genitals. And we want to really normalize sexual attraction and sexual thoughts while also creating safe spaces to experience those things. Moving on to the next slide. We've got a couple of examples of social stories, again, that can be useful and helpful with puberty, and we'll talk about a number of specific resources in just a minute. Next slide. I want to talk in these teen years. So as we move through the teen years and as adulthood is quickly approaching, the unwritten social rules of sexual behaviors and relationships are really complex and not explicitly taught, particularly to youth with autism. And because the social and intuitive learning of these things may be limited for some autistic individuals, we really want to make sure that we're teaching these things explicitly, using trusted teachers, counselors, and therapists to help us cover topics like providing direct instruction to your teenagers about some of the things that they may be experiencing in their body changes. Also teaching about consent in romantic and sexual relationships, the impact of things like drugs and alcohol, and how we can help people respond to peer pressures. Sometimes providing things like scripts and social stories can be helpful opportunities to role play how your child or young adult may respond in certain social situations. Next slide. So don't fear, it's not too late for those of you with older children or adolescents and young adults. There's still plenty of time to address some of these things. And really the learning here often continues well into the adult years. In the next few slides, I'm going to quickly share a number of resources. Remember, you'll get all of these sent to you after today's presentation. But I just want to make you aware that there are a lot of resources already available to help support some of this learning. So on the next slide, you'll see the Healthy Bodies Toolkit, which is available from Vanderbilt University. This is available in both Spanish and English. You can go ahead to the next slide, Wara. And there's a specific toolkit for males and females. They're fairly gender neutral, but you may want to sort of take a look at both and see which applies to your child best. And on the next slide, you'll see some toolkits also available from Autism Speaks, including a puberty toolkit that some of us on the call were involved in putting together a couple of years back. Next slide. You'll see here, there's actually a really wonderful program that has been developed through the Organization for Autism Research that's essentially an online sex ed class There are lots of modules you can pull from for individuals who enjoy exploring the internet and sort of working through self-directed curriculums. This would be something you could share with your youth. For others who may need more support, teachers and counselors and therapists and parents can pull content from each of these sections to help sort of work in a more one-on-one or hands-on way if some adaptation or modification might be needed. Next slide. There are lots of good books available out there, and I've included just one here for you to take a look at. And on the final slide here, you'll see some additional resources through the National Autistic Society in the UK, again, providing a really good resource for sex education. This is a guide specifically for parents. So definitely take a look at these, keep an eye out for those resources as we send them out to you. And in the last few slides, we're going to touch on just a couple more things here. First, once we make it through puberty, we now need to think about how we support healthy sexuality and sexual behaviors in adulthood. It's important to remember that we should be normalizing sexuality as a normal part of human development, and people with autism may need some extra support to ensure that they're engaging in safe and healthy relationships and sexual behaviors. It's important to continue to provide education about puberty, reproduction, and physical body changes. We really want to normalize sexual attractions and help create safe and appropriate outlets for these things. I mentioned internet safety here because this is a huge risk. As all of you know, with parents with kids online today, it's really challenging, and teaching internet safety is a really critical skill. And if your child or young adult is not able to manage the internet safely, ensuring that there are some parental safeguards in place to control the content that they're exposed to, and access to potential predators is really important. Next slide. All right, so as we think about relationships over time, we really want to make sure that we're making explicit how relationships change over time and across different people in our lives. Recognize that your child's interests in relationships and preferences may vary from your own and may vary from your other children. All preferences are okay. So some people may be interested in romantic relationships and others maybe not. It is important to teach explicitly about these different types of relationships and what kinds of interactions are safe and appropriate for each type of relationship, thinking about the range of relationships from acquaintances to close friends to families or romantic partners. Discuss with your child how these relationships stay the same or change over time. And introduce the idea that some relationships are healthy and some relationships are unhealthy or problematic. We want to make sure that teens can identify when relationships become dangerous or problematic so that they can reach out to you or another trusted adult should they not feel safe. And next, we're going to move on from puberty here just to talk quickly about the idea that transitions really disrupt longstanding schedules and routines. For 18 plus years, you're going to work hard to build schedules and routines that work for your child. And so often that transition out of the public school system at 18 or at 22 really disrupts the routine that you've built. Because of this, it's important to explicitly create new schedules and incorporate things such as day programs and employment opportunities. You also want to identify what new agencies and community supports are available in your area. Our chat tonight has been full of lots of state-specific agencies and supports that are really important for you to take a look at and become familiar with. We want to make sure you're building in time for leisure skills very explicitly. And if your child doesn't yet have a large repertoire of leisure skills, you may want to build that in as a goal in your IEP to have your team help your child build some of those skills as they're approaching their transition to adulthood. In addition, I want to make sure that we consider reinstating in-home or community-based behavioral support or skills training. Sometimes those services will fall off through the adolescent years, and you may need to pick back up on that as you're thinking about building some of these skills for community access and adult living. Next slide. Finally, through all of this puberty adult programming, it's so important for us to pay attention to how we support good mental health. In fact, young adults with autism are more likely to experience increased anxiety and depression. This is for a number of reasons, but sometimes the disruption in schedule, leaving the public school system and really losing that routine that they've become so accustomed to can be quite jarring. So we want to prepare for that transition as much as we can to reduce these symptoms of depression, anxiety. Help your child to build some self-awareness and build their effective coping skills. And if you notice a drop in mood or an increase in depression, consider the impact of strategies like behavioral activation, which is really the premise that you can help alleviate mood symptoms by adding in scheduled routines and activities that are helpful for sort of elevating mood and creating a new routine. And when in doubt, connect or reconnect with a trusted therapist who can help you manage and monitor your child or young adult's mental health needs. Next slide, I'll pass it to Amy.
All right. So one of the things that we wanted to say are, the questions that you should ask and planning things that you should think about are, the pediatric years are ending. Do you have a plan? Are you making a plan? Adult years are beginning. How are you building adult opportunities like living skills and community integration and social opportunities? New teams and new strategies begin, and this can be really tough. I think the visuals on the right will show like that's what a team really looks like when it's working well, and then that's what it looks like below it when it sort of all falls apart. It can be a really hard time, but teams are going to change, so anticipate it, embrace it. It's part of the evolution of growth and aging, and it can bring new opportunities and and new team members that will give your plans new life. I think the other thing we would say is any step in the process towards moving into adulthood is a good step. So celebrate it and give yourself credit. And remember, it's not about how fast you transition into these adult years. It's taking steps to get there and building on what you've accomplished. Next slide. So from the case today, we know a few things. William is an extraordinary youth who needs a supported family and a committed team to plan and assist him as he moves into adulthood. This is not a surprise to any of the family members who are on this and any of the individuals that are on this today. As you go through the transition process, remember a few things. Partner with many, add many people to your team, professionals and community-based people who can be creative and committed and enrich what you've already built. I think also teach and learn with all, be a co-producer and invite other people to be a co-producer on your team. Seek support for you and your family. Go to therapy, take a pottery class, do whatever you need to do to make sure you take care of you so you stay energized. Build teams committed to the journey. Team building is really important. So build a team that feels good and takes action. And above all, ask for help. Ask for help when you need something or when you feel like something needs to change, and never take no for an answer. All right, so we're gonna go ahead and end this section. We're gonna go into questions now.